Mr. Smith, hi, I'm Sarah. I'm one of the nurses looking after you tonight. Is it okay if I just come in and have a chat for a few minutes?
Yeah, come in. Sorry, I couldn't sleep. It's really uncomfortable.
Oh, I can see that. You look really unsettled. That must be exhausting on top of everything your body's been through today. I just want to make sure we're doing everything we can to help you feel more comfortable. Is it all right if I ask you a few questions about the pain?
Please, yes. I mean, they gave me something earlier, but it's worn off, I think. And honestly, I didn't expect it to be this bad. Nobody told me. I mean, they probably did. I just didn't think it would feel like this.
That's really common, actually. A lot of patients tell me the same thing. The reality of it catches you off guard, even when you've been prepared, right? So, can you point to where it hurts the most?
It's mostly here, right here, where they made the cuts. But also, and this sounds weird, my right shoulder is really aching. Is that normal?
It does sound strange, but it's actually really normal after this type of surgery. Completely expected. It's called referred pain. The gas they use during the procedure can irritate the diaphragm, and that sends pain signals up to the shoulder. It usually settles within a day or two, but I'm glad you told me. Now, can you describe what the pain actually feels like? Sharp, dull, ache, burning. What's the quality of it?
At the wound sites, it's more sharp. Like if I move or take a deep breath, sharp. And the shoulder is more of a deep ache. It doesn't go away. It's just sort of sitting there.
Okay, that's a really clear description, thank you. And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst you can imagine, where would you put it right now?
Right now, probably a 7, maybe a 7.5. Like I can talk to you, but if I breathe in fully, it goes up to, I don't know, 9, and I'm scared to cough.
A 7 at rest. That's significant. We really want to get that down for you. And actually, being afraid to cough or breathe deeply is something we need to address because after abdominal surgery, it's really important for your lungs. We can talk about strategies for that too. When did the pain get to this level? Was it gradual?
It sort of crept up. I had the last lot of painkillers around 5 o'clock maybe. It was fine for a couple of hours, then it started building. It's been worse since about 9, I'd say.
So, it's been escalating for roughly 2 hours. That timing tells me the previous analgesia has worn off. Does anything make it better at all? A certain position? Anything you've tried?
Lying really still helps a bit, if I keep very still. But I tried rolling onto my side. And no, that was a mistake.
That's consistent with what we'd expect. Movement aggravates wound pain. One more thing. Any other symptoms alongside the pain? Feeling sick? Fever? Anything unusual?
I was quite nauseous when I woke up, but that's settled. No fever that I know of. Actually, I haven't really passed much urine since the surgery. I'm a bit worried about that, but I didn't want to bother anyone.
Thank you for mentioning that. That's exactly the kind of thing I need to know. I'll check your fluid balance chart and observations in a moment and let the team know. It could be the pain itself or fluid intake, but we'll look into it properly. And please, don't feel like you're bothering us. You are never bothering us. I'd much rather you call me and it's nothing than lie here worrying alone for hours.
Yeah, I've just been lying here wondering if something's wrong.
Right. Here's what I'm going to do. Your pain is at a 7. The last analgesia has worn off and you're due for more. I'm going to check your medication chart now and speak with the doctor if needed. I'll also bring you a pillow. Holding it firmly against your abdomen when you cough or move really does reduce that sharp pain, and I'll sort out those observations and fluids while I'm at it. How does that sound?
Yes, please, thank you. Honestly, I feel better just having talked about it.
Good. That's exactly what I want to hear. I'll be back in a few minutes. Use this call bell if anything gets worse before I'm back, okay?
Thank you, Sarah.